Bending the curve of chronic disease means easing its burden across millions of lives. It's a journey that should feel connected, but we live in a world where care is delivered in pieces. A diagnosis here, a prescription there, and everything's left to unfold on its own. Between a hopeful start and real life, there's a gap people navigate alone. But what if that gap was an opportunity? A space where one prescription opened the way to something more.
We're at a pivotal moment in the treatment of chronic disease. In real time, we're seeing the rise of new obesity therapies that can dramatically change outcomes at scale. That excites us at Omada because it brings us closer than ever to bending the curve of chronic disease. At the same time, GLP-1s are being adopted across a healthcare system that's fragmented and under pressure to keep pace. So we asked ourselves, how can we best deliver obesity care as GLP-1s gain momentum? And how can we extend our holistic care model, one that already connects support across care teams, conditions, and the day-to-day lives of our members to meet this moment? The answer was clear. Integrate prescribing into our model so every prescription is an entry point into Omada's proven whole person care. And extend that care to address a risk that often travels with obesity, high cholesterol. That means members entering Omada through a GLP-1 prescription receive whole cardiometabolic support from day one. At no point do our members have to navigate this GLP-1 journey alone. From initial visit through progress, setbacks, adjustments, discontinuation, and beyond, it is a guided medication experience. Here is Wei Li to walk us through it.
We know health is won or lost between doctor visits. It's the foundation of Omada's model. But the reality is it can be days, weeks, or months, or maybe never that a person finds Omada and the kind of between visit support they need. That gap is huge. Now that prescription is the entry point into care, we've closed that gap. From day one, members move directly to a connected longitudinal care experience. Here's what that experience looks like. Imagine you're a member considering a GLP-1 for the treatment of obesity. Checking a box signals your interest and instantly alerts your care team. In as little as 5 minutes, you're offered a visit with an obesity medicine trained provider, right from the Omada app. During the visit, the provider confirms whether a GLP-1 is right for you based on your history and your goals. If it is, the prescription appears in your care plan. You choose your pharmacy and pick it up. Prior authorizations are already handled. Now comes a critical phase of the journey. What happens after the prescription? This is where the guided medication care experience does its most important work. With prescribers and care teams fully integrated, there's no gap between medication and the between visit support that consistently drives strong outcomes across our programs. That support is built around a multidisciplinary team, including a health coach and appropriate clinical specialists. With the prescribing provider now included from the start, everyone shares the full picture. By seeing your progress and setbacks, including any side effects you've noted, they can step in with the right guidance at the right time. It's also important to understand how the body responds to weight loss. Research shows that up to 40% of the weight lost on GLP-1s can come from lean mass. That's why GLP-1 support includes an exercise specialist who designs a personalized plan to help preserve the muscle that's essential for strength, mobility, and long-term health. Rounding out GLP-1 support are the tools that make it easier to build lasting, healthy habits. AI-enhanced personalized insights are right on your home screen. You can track meals, get nutrition coaching, access practical resources, and stay connected with a supportive community along the way. Now let's look at the refill stage, which we see as a uniquely critical juncture. Rather than an automated refill, you and your provider review labs, progress, and engagement to determine if a change is needed, dose, formulation, or otherwise. With the rapid influx of GLP-1s, this step ensures responsible, informed prescribing and value-conscious care. Now let's say your weight loss is on track, so your provider prescribes step-down therapy. Your care plan updates, your care team is notified, and your coach, lessons, and community stay with you to help you maintain progress through GLP-1 discontinuation and beyond. With the rapid influx of GLP-1s, adding prescribing to our platform opens the door to reach more people and connect them to Omada's proven model of continuous whole-person care. And that's where it gets exciting. Because we're not just expanding access, we're delivering outcomes that outperform other real-world evidence. But what happens when a benefit strategy doesn't cover GLP-1s? We created GLP-1 FlexCare as the solution. It's designed for members paying out of pocket, giving them Omada's between-visit care and access to their GLP-1 prescription directly through our platform, with options for some of the most affordable cash-paid GLP-1 prices on the market.
To us, the best care model is a holistic one. So when a member enters Omada at the point of prescribing, we don't just support their GLP-1 journey. We look at the full cardiometabolic picture that often accompanies obesity. Over the years, our care model has proven that a whole-person approach can move the needle on diabetes and hypertension. Now, we've added cholesterol, because high cholesterol rarely exists on its own. More than 60% of people with obesity have elevated lipids, alongside diabetes and hypertension, making cholesterol support an essential part of addressing cardiometabolic risk. Whatever combination of diabetes, hypertension, or high cholesterol a member is managing, we treat them together in one connected experience. Wei Li, walk us through the highlights of Omada for cholesterol.
Thanks, Sean. Omada for cholesterol builds on the same proven care model, infrastructure, and experience members already trust. And it's now applied to one of the biggest drivers of heart attack and stroke risk. Our focus is on reducing cardiovascular risk through best-in-class evidence-based care. The program does that by wrapping targeted clinical and lifestyle guidance around the everyday habits that influence cholesterol. From the outset, members can chat with their dedicated health coach and cardiometabolic specialist for integrated care plan support. They're able to track medications and lipid panels in just one place, supporting adherence. Cholesterol learning paths translate lipid guidance to practical heart-healthy actions. Members can use simple meal tracking and cholesterol-aware AI nutrition chats to get instant guidance on heart-healthy food swaps. Along the way, communities provide accountability, encouragement, and ongoing support. Omada for cholesterol gives our members structured, ongoing support tailored to their clinical behavioral and lifestyle needs. And unlike point solutions that fragment care, members also get support for overlapping conditions with one continuous experience. This is a specialized holistic care journey, integrating human care and smart technology in a way that's distinctly Omada.
For 15 years, we've been building and refining a care model that we know works because we have the outcomes to prove it. It's about care that's continuous, coordinated, and built around a whole person, not just a single condition at a single point in time. This year, we pushed that further than ever. We bridged the gap between GLP-1 prescriptions and the support that helps people succeed, and we extended that same between-visit care to high cholesterol as part of one connected cardiometabolic experience. Health is won or lost between doctors' visits, and that's exactly where Omada shows up. To bring this care to more lives at scale, we rely on the strength of our partnerships. We're proud to partner with the nation's 3 largest PBMs, alongside over 2,000 partner organizations. Today, we're more than 2 million member journeys strong, and we're all moving the same direction toward bending the curve of chronic disease. I know we can slow its climb, change its course, and ease its burden across millions of lives together.